If you haven't heard much buzz lately about the shortage of personal protection equipment in hospitals amid the coronavirus pandemic, don't let that convince you it's no longer an issue. According to a recent statement from the president of the American Medical Association, that same situation exists today, and in many ways things have only gotten worse. AMA President Susan Bailey says there is still a persistent shortage of N95 masks, gowns, and other forms of PPE, seriously hindering the ability of healthcare workers to do their jobs safely and to prevent further spread of the virus. Now, being more than 6 months into the pandemic, Bailey says there's no excuse for still barely scraping by, but acknowledges there are many reasons. She admits that the process of getting protective gear in mass quantity is a complicated one, mostly because the majority of the gear is produced outside of the U.S. But ultimately, she believes it comes down to a lack of coordination on a national level, which is why she says she's urging the White House to use the powers of the Defensive Production Act, a tool only available to the president, allowing the expedition in supply of critical materials, in this case, personal protection equipment. Back in March, President Trump tweeted that he had signed the Defensive Production Act, but would only invoke it in a worst-case scenario. Whether now is that time is still uncertain. Reporting for NewsNet, I'm Abigail Taylor.